Be careful when taking anti-inflammatory medications. I had a patient in my office literally 2-3 days ago that was telling me he was taking 2,400 milligrams of ibuprofen and had been for months. Now we think that's generally the upper limits of what's safe to take on any given day, but he had been doing that for a long period of time. It was for an ankle injury, I think, before he decided to see a doctor. And that's probably not the best idea. I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on all sorts of sports and exercise, injuries and injury treatments and injury prevention for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. Now, because we can buy anti-inflammatory medications over the counter, we might think that they're safe. And generally, when taken in low doses and you just take them every now and then, they're probably not a real big deal. But if you're taking a lot of it, it can be a problem. First thing that I'll recommend is that you try to do it initially after an injury to get swelling down, but for a short period of time. You've heard that acronym RICE, and that stands for rest, ice, compression, and elevation. All of those can help decrease pain, decrease swelling, to basically help get you back to what you want to do. And using anti-inflammatories for a few days as part of that is probably okay. Now, again, you got to watch how much you take. When you take huge handfuls of them, that may not seem like a big deal, but those medications have side effects. For some people, that may be fairly mild side effects like heartburn and issues, along those lines. But you can get serious issues as well, things like a gastrointestinal bleed or an ulcer. So definitely be very careful about those. If you have medical conditions that potentially anti-inflammatories could make worse, definitely talk to your doctor about that as well, because those medications can interfere with medications you're on for bleeding and high blood pressure, kidney problems, things like that. So definitely talk to your doctor about those. The last thing I would mention is that if you've had an injury now, that you've been using Advil or Aleve or something like that for, and it's not getting better, and now it's been a week or 10 days or 2 or 3 weeks, and you don't seem to be making much progress, not just with the anti-inflammatories, but the ice and the compression and the activity modification, it might be a good idea to see a doctor. Maybe there's some sort of structural injury that is, why you're not getting better. But rather than just taking medicines for long periods of time, sometimes it can be helpful to find out what the exact nature of that injury is so that you can learn a treatment plan specific to that injury that gets you back to sports and exercise. Do you take anti-inflammatory medications for injuries to get you through sports, to get you through exercise? I want to know your experience. So below this video, share your thoughts or your ideas. I'd love to read it, and I know viewers all over the world would love to hear what you have to say as well. If you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my YouTube channel. Click the box in the upper right corner of the page. I record a couple of these videos every single week, and I'll deliver those directly to you. Thank you so much for watching. Again, just be careful when you take anti-inflammatory medications. Don't forget to subscribe, and I look forward to seeing you right here next time.